Good afternoon. My name is Jennifer Schultz. I'm the Senior Vice President of Marketing and Communications here at OU Medicine, and we have another episode of Oklahoma Health News, this time powered by the Children's Hospital at OU Medicine. Very excited today. I have Dr. David Crawford here. Dr. Crawford is the Director of Pediatric Bone Marrow Transplant at the Jimmy Everest Center at Children's Hospital and a pediatric oncology and hematologist.
Great.
So thank you for coming. Really appreciate you having you on today. We're going to talk a little bit about a really, I think, innovative therapy called CAR T-cell therapy, which for many people that follow us, saw us announce this for adults about a year ago at the Stevenson Cancer Center. And we are now offering this for pediatric oncology patients, which is very exciting. Can you tell us a little bit about what CAR T-cell therapy is?
Yes, so CAR T is an acronym, chimeric antigen receptor T cells. So what that means is we take the patient's own white blood cells, a portion of them called T cells, and they're engineered so rather than attack virus-infected cells, they can attack leukemia cells. And so basically we sick the patient's immune system on the leukemia. And it's, as a completely novel therapy for treating leukemia, it can be effective when we've exhausted all other viable means of treating that malignancy.
So you're saying that for children, it's used for leukemia specifically. Am I understanding that correctly?
So the version of CAR T cells that we have right now is designed for children and young adults with leukemia that is called pre-B leukemia. And so, yes, it's for children and adults up to age 25.
Now, for kiddos and young adults, really any leukemia patient, they're fairly immunocompromised. So this is a therapy that, how does that kind of play into the therapy just for the folks at home with it being in more of an immuno type of a therapy?
So our patients are all immune compromised, but everything that we do to them to try to rein their leukemia in further leads to additional immune compromise, essentially. Chimeric antigen receptor T cells, or CAR T cells, are actually less immunosuppressive than many of the other therapies that we do. So in a way, it's often easier on the patient than alternatives might be.
And it's really trying to harness the power of your own body's immune response to attack the cancer cells. Is that fair to sort of assume? I'm trying to think of how maybe a mom or dad at home might think about it.
So normally white blood cells do a lot of different things, but one type of T cell, as it's called, which is a kind of white blood cell called a lymphocyte. T lymphocytes normally will rid the body of viruses by killing cells that are infected with viruses. And so you essentially eliminate the virus by eliminating the place where the virus can grow. And so what is done with CAR T cells is we take cells out of the patient, we essentially train them to recognize the leukemia cells as being similar to a virus-infected cell, and so we redirect the power of the immune system to attack those leukemia cells. So it's harnessing their immune system to work in ridding the body of the leukemia.
How long has this treatment been available at Children's, and how long has it been kind of available for children across the country?
Well, it's been available in experimental forms over the course of maybe half a dozen years or so, but for it to when it became available in a commercial product that was available to anybody that was eligible to receive it was about 2 years ago. We have been in the process of arranging to have this therapy here at OU for a period of time, most of that 2 years. But finally we have it here and we're ready to use it. It's been approved for use at this institution less than a month, but we're going to be doing our first patient within a month or so.
That's very, very exciting. Tell me a little bit about what the benefits are for children that are receiving this type of therapy versus other types of therapies for leukemia.
So at present, this therapy is primarily used for people that for patients that have no remaining hope, essentially. So it's patients that have relapsed multiple times that we essentially know will not have any chance of cure with standard treatments. So such patients, we now have probably 50% chance of curing with CAR T cells. So many times over the course of my career, I've had to tell patients, I have no remaining therapies that could be useful for you. There is no question but that you are going to die of this malignancy. And believe me, those kind of conversations are truly horrible.
Yeah.
But I've had many, many of them over the years. With this, I have an opportunity to give them hope and will be able to cure a very significant fraction of those patients.
That's really exciting. So really, CAR T therapy, cell therapy coming to Oklahoma is really hope for parents and for kids when you're maybe facing something that's scary like the cancer, where it makes it hopefully a little less scary, it sounds like.
Absolutely. Of course, this is for the patients that are in the direst of straits, and we have many other treatments available for patients that aren't in such a desperate situation that are very effective in treating them. But this just adds one more treatment opportunity for those that otherwise had no chance.
So really, when a parent is working with your team on treatment for their child, there's going to be several things that would probably be the treatment, the course of treatment, where this is that sort of final hope. So if someone's looking for that second, third, or fourth opinion, maybe they've been somewhere else doctoring with pediatric oncology, leukemia with their child, what makes them a good candidate to look at coming here and talking with you about if that's their sort of final option?
Well, CAR T cell therapy is only available at this institution in the state of Oklahoma. So this would be the obvious referral place for patients that need that therapy if they're at other institutions. Now, there aren't very many institutions that treat children with cancer, even nationwide. But there's only one other one in the state of Oklahoma, and they certainly refer their patients to us and would for this sort of therapy. So this would be the logical place for them to send their patients, as it would be for my colleagues here that are treating leukemia patients.
Right.
They would naturally refer them to us.
Do you know how far you would have to drive to get CAR T cell therapy for a child if you were living in Oklahoma City? It's an out-of-state trip, clearly. Do you know how far?
Well, before last week, it was either Dallas or Houston.
Okay.
I'm sorry, Dallas or Kansas City. I apologize.
Okay.
So Dallas is what, three and a half hours, depending on traffic. Kansas City more like 5, and so it really very inconvenient. So much easier to go across town, that's for sure.
Yeah. Well, it sounds like we've really are able to offer another service to Oklahomans where they don't have to leave the state for innovative therapy that really provides hope to families and to patients. So that's always really good to hear. What should someone expect when they're coming in for CAR T treatment? What's that like?
Well, it's a multi-step process. The first thing we do is we have to collect white blood cells from the patient. So in order to do that, we do a process called leukapheresis. It's actually done by our partners at the Oklahoma Blood Institute. And what they do is they actually remove blood from the patient, and they have a fancy machine that selects out the white blood cells and returns the rest of the blood to the patient. So then essentially collecting a product of white blood cells that is sent away to the company that manufactures CAR T cells, which is named Novartis. Novartis then introduces foreign genes, or a foreign gene, into these cells that allows those cells to become leukemia killers. And then they expand those cells to give us a very abundant population of these leukemia killing cells. And then eventually they return them to us around 4 weeks later. So then the patient will receive some chemotherapy to sort of prepare them for the CAR T cell therapy, and then we will infuse the CAR T cells. Now, that is going to be done with a short-term stay in the hospital, and then they'll be discharged, but they'll be required to stay very close by because there are a number of complications that can arise from CAR T cell therapy. So many or most of our patients will probably actually stay at a very neat little place called the OK Kids Corral, which is essentially on campus here, that allows our patients to stay for free while they are a minute's walk from the hospital. So most of our patients will be over there, and then if they have complications, they can return to us. There are a couple of complications that are common. One of them is referred to as cytokine release syndrome. And that can start as just having a fever and headache, but can be actually life-threatening if not managed properly. So we want the patients to be close by, so we're prepared to quickly give them therapy to prevent them to get into a state that could be potentially dangerous. The other complication is now referred to as ICANS, which is essentially a toxicity to the nervous system that can arise from CAR T-cell therapy. And we're also prepared to treat that complication as well. So there are a lot of things that can happen with CAR T cells. In general, it's safer than the alternative, which would be bone marrow transplantation, which we would, and in many cases, we may choose to do CAR T cell therapy in advance or maybe even in the place of bone marrow transplant.
It's very interesting. I think one of the things that is running through my mind as you're talking about staying at the OK Kids Corral and some of the process for treatment is really the pandemic, which is something that no matter how many things maybe kind of reopen, it's always rolling around in the back of a parent's mind of how the pandemic would impact this type of treatment. What are some of the precautions and things that you and your colleagues have been thinking about for your patients inside of the Jimmy Everest Center?
So there's an institution-wide plan to limit an opportunity for exposures. So essentially, all patients and their family members that are coming into the hospital are screened, both for risk factors and for any symptoms that might be present that might be a warning of COVID. Patients are actually screened prior to admission for this kind of therapy to make sure that they are not presently actively infected prior to beginning the treatment. And then exposures are limited tremendously, so we actually limit visitors. And in this case, at the present, during the active pandemic, we've limited it to just one visitor, and it must be an adult that stays with the patient, which I think is probably one of the biggest things, because the more traffic, not car traffic, the more people, the more likelihood there is to be an exposure. So, and then of course everyone's wearing masks, and we use precautions like gowns and gloves when indicated. Everyone's always washed their hands in and out of every room. So I think every precaution possible has been introduced, as well as careful screening over at the OK Kids Corral as well. With that in place, we've not had a single case of coronavirus at Children's Hospital or at the Kids Corral this season at all.
Within the patient population of the cancer center, correct? Yes. Yep.
Absolutely.
Yeah, so I mean, really the infection rate we have seen for pediatric oncology patients sounds to be quite low.
Well, it's 0 in Oklahoma City.
Yeah, that's good to hear. So I always have a question I have to ask everybody when they're here, and one of the, I've asked it kind of related to COVID, but I'm going to ask it with you being a pediatric oncologist related to that. What is, if you had a family friend or a loved one have their child diagnosed with cancer, what is the tip or the words of comfort you would give them?
So in the majority of cases, we have very good treatments for childhood malignancies, and we can cure the majority of most patients with childhood cancers, and the vast majority of patients with many of the most common types of childhood cancer. So for example, with ALL, or acute lymphoblastic leukemia, our cure rates are just phenomenal. So at the time I was born, the cure rate for ALL was really close to 0, and now it's around 90%. So we have a tremendous opportunity in most patients to cure them, and most patients will go on to be long-term survivors and parents themselves.
That's wonderful to hear. Definitely words of comfort and words of hope for parents that are facing a cancer diagnosis for their child. My tip would be to come to Children's after listening to Dr. Crawford, so thank you so much. This is Jennifer Schultz. We are going to see you later next week with Oklahoma Health News, and keep your questions and your topics coming. We always shape these to be around what you're interested in. We'll see you later this week.